Legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, January 11th. I'm Brent Anir. This is the first of our weekly summary videos about the top news in medicine from the legislature this session for you, our TMA members. Thanks for checking it out.
The Senate of the 86th Legislature of the state of Texas will come to order.
Tuesday was opening day. Texas senators and representatives convened in the Capitol for the 86th session of the Texas Legislature. The first order of business for the House of Representatives was to elect a new speaker. TMA's Vice President of Advocacy, Darren Whitehurst, introduces us.
Dennis Bonnen was out of Angleton, was elected today to serve as the Speaker of the Texas House of Representatives, which is really good news. I've known Dennis for a long time. He has served in the legislature for a long time. I think is a really hard-working, hard-charging member, and I think will do an outstanding job in the Texas House.
Lieutenant Governor Dan Patrick will once again preside over the Senate, though he missed Tuesday's session because he was in Washington, D.C. We will see changes in both chambers this year. 12 new Democratic members are in the House, and 2 new Democrats were elected to the Senate. Republicans still hold majorities in both chambers. Darren described another big change in the Senate that will affect medicine.
One of the things that we saw on the Senate side is Charles Schwartner, orthopedic surgeon out of Georgetown, basically has said that he's not going to be serving in the Senate Health and Human Services chair, which is certainly a loss for us. But there are members waiting in the wings, and again, we've got good working relationships with those individuals, and looking forward to whoever's going to pick that helm up and run forward with it.
More on the key players in a bit, but it's really all about the issues. TMA's Healthy Vision 2025 details medicine's top priorities for this session. To see it, visit texmed.org/healthyvision or tma.tips/HV2025 to download and read the PDF version. We asked Darren to review these top issues for us. Here is the first half of that interview. Let's talk succinctly as we can about issues because we have a long laundry list.
Absolutely. Doctors always have a long laundry list. Let's start with the budget. Yesterday, a comptroller announced that the state would have $119 billion to spend over the next biennium, the 2021 biennium. This is about $9 billion more than we had last time, is about an 8% increase. There are lots of players jockeying for that money. Healthcare, of course, is one of those. Doctors really haven't seen a payment increase in Medicaid since I've been in the legislature. Close to 20 plus years, haven't seen pay increase in Medicaid, and so we will be advocating for that. We'll be competing against public education, against infrastructure like transportation. It will be a challenge, and again, I think there are some opportunities for success in that realm to try and get appropriate payment for doctors in the Medicaid system. On the medical education front, we've made great successes on graduate medical education. We're hoping to continue those, and as most doctors know, that's not a 2-year budget cycle funding stream. It takes 3 to 6 to 7 years of training on the residency side, so we have to make sure that we continue the progress that they made during the last legislative session. The budget should be exciting, as it always is. Lots of curves. It really is the only thing that the legislature is required to do, so we will be working very closely on those issues.
What about health insurance, adequate networks? Right.
Health insurance is always a big issue for us in the legislature. Obviously have plans to file legislation, proactive legislation, have worked very closely on things like prior authorization, trying to get improvements, trying to make the plans more accountable to the networks that they're setting up, and ultimately holding them accountable to make sure that physicians get paid in a timely manner for taking care of their enrollees, our patients, and again, want to make sure that that the legislature sets up a good framework to make sure that those plans are held accountable for the products that they're out there selling.
Corporate practice of medicine is back.
Corporate practice, having lots more physicians in employed situations than have when I first started in the business, and nothing wrong with that. Again, is that what TMA wants to represent is physicians and their ability to take care of their patients, and have concerns about some of these corporate entities basically trying to dictate the practice of medicine, telling physicians test to order, requirements that they would have, and some of those not in the best interest of patient care and the best interest of their patients. We want to make sure that physicians are able to continue to advocate, be the top advocate for their patients relating to care that's provided to them, and that they're not receiving dictates from their corporate entity if they're being employed.
Scope of practice issues, people seeking to practice medicine without having gone to medical school.
Well, and this is a perpetual issue as well, is that everybody wants to practice medicine. Very few are willing to go to medical school to do it. And so they typically turn to the legislature asking for their approval to allow them to treat patients. And again, we believe that diagnosis and prescribing is the practice of medicine. And if you want to do those things, then you should go to medical school. And we've had a lot of non-physicians that have attended medical school after being a nurse or PT, a chiropractor, a podiatrist, that have gone back to medical school because they want to practice medicine. They don't want, again, we got lots of good people in healthcare roles that are a good support system for physicians, but they shouldn't be replacing physicians. And so if you want to practice medicine, then you need to go to medical school and have the appropriate training and education to do so. We'll see those fights again this next legislative session.
That barely scratches the surface of all of medicine's important issues. We'll show you the second half of that extensive interview in next week's Hotline, including critical issues like maternal health. We hope you will join us.
You have, in fact, 4 doctors of the day with you.
That's Dr. Representative John Zerwa speaking Tuesday on the House floor about all the physicians serving as state representatives, introducing them as the day's Physicians of the Day. Medicine has strong voices at the Capitol this session, and TMA's Marcus Cooper introduces us to the new and the veteran voices at the Capitol this session.
Well, Brent, as you know, the 2018 elections brought some changes to the Texas Legislature, but Texas medicine will be represented by veteran TMA members in both chambers and a fresh new face in the House of Representatives. In the Senate, the family of medicine is represented by 3 returning members: Senator Dr. Don Buckingham of Lakeway, Senator Dr. Donna Campbell from New Braunfels, and Senator Dr. Charles Swartner of Georgetown. Over in the Texas House, Representative Greg Bonin of Friendswood returns, and the newest addition to the family of medicine is recently elected Representative Julie Johnson of Carrollton. She's a member of the TMA Alliance. Also returning, Representative Dr. Tom Oliverson of Cypress, Representative Dr. J.D. Sheffield of Gatesville, and Representative Dr. John Zerwas of Richmond. We'll be reporting on all of our TMA physician legislators at the Capitol in the coming weeks and months as they tackle the issues important to Texas medicine. Brent, it's going to be a long session, but we're looking forward to covering all of our members.
That's great. Thanks, Marcus. Finally, mark your calendars to come to Austin and go to the Capitol for the initial TMA's First Tuesdays at the Capitol Lobby Day. That's Tuesday, February 5th in Austin. For more information, visit texmed.org/firsttuesdays. First Tuesdays are your opportunity to discuss healthcare issues with lawmakers and tell them what you believe is best for your patients. That's it for now. I'm TMA's Brent Anier. Thank you for watching, and please share this video with physician friends and colleagues, and make sure they sign up for TMA's Hotline emails in Texas Medicine Today. Join us again next week for TMA's Legislative News Hotline.